Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1. Focusing on immunology. Let's get started with question number 1. For the following case, which of the following studies is most likely to be abnormal? A. Eosinophil count. B. Serum C4 level. C. Serum C8 level. D. Serum IgA level. E. Serum IgE level. The case scenario is: a 7-year-old boy is brought to the office due to sudden onset of facial swelling 2 hours ago. He has had notching or pain other than a sore throat over the last 2 days, for which he has taken acetaminophen. The patient has had similar episodes of facial swelling that resolved spontaneously after a few days. Temperature is 37. Blood pressure is 100 by 78. Pulse is 95 per minute. And respirations are 24 per minute. Examination shows non-pitting edema of the cheeks, lips, and tongue. There is no tenderness or erythema. The question is: which of the following studies is most likely to be abnormal? Your options are: A. Eosinophil count. B. Serum C4 level. C. Serum C8 level. D. Serum IgA level. E. Serum IgE level. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is Serum C4 level. This question is designed with the focus to assess your ability to apply foundational science concepts. This patient's recurrent facial swelling is most likely due to hereditary angioedema, which is characterized by a deficiency or dysfunction of C1 inhibitor, previously referred to as C1 esterase inhibitor. Poor C1 inhibitor function leads to elevated bradykinin, a peptide that causes vasodilation and increased vascular permeability, resulting in edema. Presentation is typically in childhood or adolescence with episodes of swelling affecting the skin, for example, face and extremities, and mucosa of the gastrointestinal tract and/or larynx. Attacks are often precipitated by minor trauma, for example dental procedure, or emotional stress, and are not associated with itching, tenderness, rash, or classic medication triggers, for example, ACE inhibitors, nonsteroidal anti-inflammatory drugs. Initial evaluation of hereditary angioedema is with complement testing. Low C4 is characteristic because, in the absence of C1 inhibitor, unregulated activation of C1 leads to excess activated C1 and, in turn, unchecked cleavage of C4. Diagnosis is confirmed by a decrease in functional C1 inhibitor level. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A and E. Eosinophil count and serum IgE level. Elevated eosinophils and IgE are associated with allergic conditions. In contrast to bradykinin-mediated hereditary angioedema, allergic angioedema, for example anaphylaxis, is due to histamine release from activated mast cells and presents with pruritus and urticaria in addition to swelling. C. Serum C8 level. C8 is involved in the formation of the membrane attack complex, which, when deficient, results in increased susceptibility to Neisseria infections, not facial swelling. D. Serum IgA level. Selective IgA deficiency increases risk for anaphylaxis, which can cause angioedema. However, this risk is only with transfusion of blood products and would present with other organ system involvement, for example bronchospasm, hypotension, and urticaria. IgA deficiency is also associated with certain autoimmune conditions, for example, celiac disease, systemic lupus erythematosus, but none of these would present with isolated facial swelling. Your take-home message from this question is that hereditary angioedema is characterized by recurrent episodes of cutaneous and/or mucosal swelling due to C1 inhibitor deficiency. C4 levels are low due to uninhibited cleavage of C4 by excess activated C1. Feeling confident? Click above to keep learning. But hey, we all learn at our own pace. If you need a refresher, rewind and revisit the material. Our top-notch resources are here to help you ace those exams, especially the USMLE. Share the knowledge, subscribe, and let's conquer this together.